TechCare is a new telemedicine provider transforming healthcare with its patient-centric approach and to provide convenient and affordable access to quality health care. It also aims to serve the needs of underserved and busy people by ensuring they receive medical care when and where they need it. At its core, TechCare's telemedicine platform offers a comprehensive suite of services, including but not limited to video consultations, lab testing, online prescription refills, and access to healthcare professionals. Patients can schedule video consultations with licensed physicians from various specialties, including general medicine, pediatrics, dermatology, and mental health. Patients can conveniently ask for a lab test and refill their prescription online without the need to contact their doctor's office, saving time and effort. They can also have access to a dedicated team of healthcare professionals, including doctors, nurses, and pharmacists, who are readily available to answer questions, provide support, and assist patients in managing their health. Further distinguishes itself from its competitors through its groundbreaking integration of VR reality technology into its platform. Lectures virtual clinics provide an immersive and personalized healthcare experience, allowing patients to interact with AI-powered healthcare provider avatars and utilize medical devices for related clinical settings. VR technology enables real-time remote monitoring of patients, allowing healthcare providers to track vital signs and personal VR rehabilitation programs help patients recover from injuries and manage chronic pain, offering a convenient and effective alternative to traditional in-person therapy. Moving on, the telemedicine industry is a broad term that encompasses a wide range of services that deliver healthcare remotely using telecommunications technology. These services can include video consultations, remote patient monitoring, e-prescribing, and online health education. The telemedicine industry is distinct from the traditional healthcare industry in several ways. First, it is more focused on providing convenient and accessible care to patients, regardless of their location. Second, it is more reliant on the technology to deliver care. Third, it is more patient-centered as it empowers patients to take control of their own health. For the geographic scope of competition, the telemedicine industry is global in nature, with companies operating in all parts of the world. However, the level of competition varies depending on the region. In developed markets, there is a high level of competition from established telemedicine providers, as well as from the traditional healthcare providers that are offering their own telemedicine services. In developing markets, there is less competition, but there is also a greater need for telemedicine services. Moving on to the quarter's five forces, the bargaining power of suppliers in the telemedicine industry is moderate. There are a number of suppliers of telemedicine technology and services, and the industry is not heavily reliant on any one supplier. However, some suppliers, such as those that provide video conferencing software, may have some bargaining power due to the proprietary nature of their products. The bargaining power of buyers in the telemedicine industry is moderate. Patients are generally price sensitive, but they are also willing to pay a premium for convenient and accessible care. Healthcare providers may also have some bargaining power as they are the ones who ultimately decide whether or not to adopt telemedicine services. The threat of new entrants in the telemedicine industry is high. The industry is relatively new and there are low barriers to entry. This makes it easy for new companies to enter the market and compete with established providers. The threat of substitute products or services in the telemedicine industry is moderate. There are a number of other ways to access healthcare, such as in-person consultations in traditional brick-and-mortar clinics. However, telemedicine is a convenient and affordable alternative that is becoming increasingly popular. And lastly, the rivalry among existing competitors in the telemedicine industry is high. There are a number of established medicine providers competing for market share. This competition is driving down prices and improving the quality of services. For the key participants in the telemedicine ecosystem, for the buyers and buyer groups, there are individual patients who seek convenient and accessible healthcare options, healthcare providers, which are hospitals, clinics, and individual practitioners expanding their services and patient reach. Also, there are employers offering telemedicine benefits to employees as part of wellness and program. insurance companies incorporating telemedicine services into their coverage plans, and lastly, government agencies improving access to healthcare in underserved areas through telemedicine initiatives. For the suppliers and supplier groups, there are telemedicine technology providers who develop and provide telemedicine software, hardware, and platform solutions. Also, there are telecommunication companies that ensures the necessary infrastructures and bandwidth for telemedicine services. For the medical device manufacturers, it, they produce medical devices and equipment compatible with telemedicine applications. Then, healthcare content developers who provide educational and informational content for telemedicine platforms. And lastly, IT consulting and support services who offers implementation, maintenance, and support for telemedicine systems. For the competitors, there are established telemedicine providers. Those are the companies with a strong presence and significant market shares. Then traditional healthcare providers, which are the hospitals, clinics, and individual practitioners who offers their own telemedicine services. Next is the technology companies, tech giants expanding into the telemedicine realm, leveraging their expertise and resources. Lastly is the startups. These are the ones with the new entrants bringing innovative approaches and disruptive technology to the telemedicine landscape. For the substitutes, there are traditional in-person consultations, to conventional visit to healthcare providers for medical care. Also is the retail clinics. These are the walk-in medical centers and online healthcare information resources. These are the websites and platforms providing healthcare-related information and self-care advices. Lastly is the telehealth apps. These are the mobile applications offering limited telemedicine features such as symptom checkers and chatbots. For the potential entrants, the new startups are the ones who innovative companies with fresh ideas and the potential to disrupt the telemedicine market. Next is the existing technology companies. These are the tech giants with the resources and expertise to expand into telemedicine and traditional healthcare providers. And lastly is the international telemedicine providers. These are the companies operating in other countries seeking to enter new market. Moving on to to assess the underlying drivers of each competitive force, the bargaining power of suppliers. The bargaining power of suppliers is moderate. Suppliers have some bargaining power due to the concentration of suppliers and the fact that switching costs are not high. However, the low level of supplier differentiation weakens their bargaining power. Next is the bargaining power of buyers. The bargaining power of buyers is strong. Buyers have strong bargaining power due to their large number, price sensitivity, and access to information. Next is threat of new entrants, which the assessment of it is moderate. The moderate barrier to entry and the low level of product differentiation make it relatively easy for new companies to enter the telemedicine market. However, the existence of economies of scale may make it difficult for new entrants to compete effectively with established providers. Next one is the threat of substitute products or services. Threat of substitute products or services is moderate because the growing quality of medicine services, the low switching costs, and the increasing consumer preference for telemedicine all make it a more viable alternative to traditional healthcare services. Next one is rivalry among existing competitors, which is strong. The high number of competitors, the diversity of competitors, and the rapid growth of the industry are all driving intense competition in the telemedicine market.
In the telemedicine industry, profitability hinges on several factors. The surging demand for accessible healthcare in the digital age is a key driver. TechCare, our company, by prioritizing quality healthcare at home, aligns with this demand, which potentially boosts our potential for profitability. Controlling profitability involves navigating through various factors such as technological innovation, which is crucial for enhancing patient outcomes and staying competitive. So that is one relevant factor. Another one is regulatory considerations, which play a pivotal role and impacts the telemedicine landscape. In this regard, TechCare's ability to adeptly handle regulatory changes is vital for success. Additionally, scalability of technology and accessibility to healthcare professionals are governing factors for success. and profitability. For tech care, in order to sustain profitability and operational efficiency, securing a consistent supply of medical experts and deploying scalable technology solutions is imperative. In assessing the industry's consistency with long-term profitability, the focus on patient-centric care, cost-effectiveness, and advanced technology aligns with evolving consumer needs. TechCare's commitment to these values position is well for a long-term success in the industry. However, challenges loom on the horizon, such as evolving regulations and new market entrants. Continuous adaptability is crucial for tech care to weather these challenges. As such, emphasizing the need to consistently deliver on its value proposition. By examining TechCare's position through Porter's 5 core cells, it reveals a favorable stance as a more profitable player. Its patient-centric approach addresses patient negotiating power, while a focus on affordability reduces this power further. The industry's technological demands and capital requirements act as barriers to new competitors, which potentially favor established players in the telemedicine industry. The cutting edge technology not only solidifies a competitive edge for established players, but also strengthens a negotiating position in terms of suppliers. In summary, TechCare's success in the dynamic telemedicine market is intricately tied to its ability to navigate controlling factors and to consistently deliver on its value proposition and strategically align itself with Porter's competing forces. By remaining agile in the face of industry changes, TechCare not only sustains but has the potential to enhance its profitability.
Another important thing to look at in the telemedicine industry is the likely future changes in each force. So, firstly, for the threat of new entrants, it is likely that the continuous advancements of technology may make it easier for new entrants to enter the telemedicine industry. However, it is also worth noting that the telemedicine regulatory environment is still developing, and new entrants may face challenges in following future complex regulations. Next, we got bargaining power of buyers. A 2021 study by the Philippine Institute for Development Studies found that the average cost of hospitalization in the Philippines increased by 11.6% per year between the years of 2010 and 2018. Because of the rising costs of traditional healthcare, the telemedicine industry is and will be attractive to buyers. However, patients may still be reluctant in using telemedicine due to worries about security and data privacy. Next up, for the bargaining power of suppliers, telemedicine platforms will have more options when it comes to selecting suppliers thanks to the growing availability of digital health technology. For the threat of substitute products or services, traditional healthcare services may be considered as an alternative to telemedicine. Additionally, telemedicine consultation may decline with the introduction of new wearable technology and smartphone apps that offer basic health monitoring. Lastly, for competitive rivalry, it is likely that the increasing use of telemedicine will create a larger market for all parties involved, which may spur more innovation and competition in the near future.
Here are some aspects of industry structure. So certainly, let's break down the aspects influenced by competitors, new entrants, and the company tech care in the telemedicine industry. So for the competitors, the service innovation and the competitive landscape, telemedicine providers are driven to innovate their services continually. So competitors may introduce features like enhanced AI diagnostics, improve user interface for seamless patient-doctor interactions, or novel approaches to virtual care. The pressure to outperform rivals fosters a culture of ongoing innovation, benefiting consumers with advanced and efficient healthcare solutions. And then, of course, pricing strategies. These might involve revising consultation fees, introducing flexible subscription models, or offering bundled services at competitive rates. The battle for market share influences how companies price their services, impacting accessibility for a broader range of customers. And then next is new entrants. The technological advancement into the telemedicine space, it may drive to technological investment. These companies, unencumbered by legacy systems, might pioneer the integration of cutting edge technologies such as advanced AI algorithms, virtual reality, platforms for immersive consultations, or innovative data security measures. Their fresh perspectives can push the entire industry towards greater technological sophistication. And then next is regulatory compliance. The regulatory environment in telemedicine is evolving, and new entrants play a role in shaping compliance standards. Navigating complex and evolving regulation can pose challenges for these entrants, influencing the industry's overall regulatory landscape. Their ability to adapt to and influence regulatory frameworks will impact how telemedicine services are delivered and governed. And then lastly, which is the company of tech care, innovation leadership as a key player. The tech care has the potential to lead industry trends by being at the forefront of innovation. If tech care introduces groundbreaking features like AI-controlled avatars in virtual clinics or pioneers the use of VR for remote rehabilitation, competitors may follow suit. So Techers' innovation leadership can set benchmarks for service quality and technological standards across the telemedicine sector. And then for the market expansion, the Techers' strategies for market expansion can have a ripple effect on the industry. Successful expansion into new geographic regions or demographic segments can establish a blueprint for other telemedicine providers. So tech care ability to navigate diverse markets and demographic may influence how other companies approach and execute their own expansion initiatives. So overall, in conclusion, the telemedicine industry is dynamic with competitors, new entrants, and established players collectively shaping its trajectory. The interplay between those forces leads to ongoing innovation, evolving regulatory landscapes, and the continuous enhancement of service to meet the growing demand for accessible and personalized healthcare.